Can your period flow backwards? Kindly remember to subscribe, like, and leave your comments. Retrograde menstruation explained. What is retrograde menstruation? Retrograde menstruation happens when menstrual blood flows backward through the fallopian tubes into the pelvic cavity, instead of exiting through the vagina. This condition is often linked with endometriosis and can lead to pelvic pain and other symptoms. Is retrograde menstruation a common condition? Retrograde menstruation is relatively common and occurs in many women. However, not all women with retrograde menstruation experience symptoms or complications. It is estimated that a significant portion of women with endometriosis experience retrograde menstruation. What causes retrograde menstruation? The exact cause of retrograde menstruation is not fully understood, but it is thought to be related to issues with the normal flow of menstrual blood. Possible factors include hormonal imbalances affecting the uterine lining and menstrual flow, anatomical abnormalities such as a blocked or narrowed cervix, structural abnormalities in the uterus or pelvic area, and pelvic adhesions from previous surgeries or conditions. How does retrograde menstruation relate to endometriosis? Retrograde menstruation is commonly associated with endometriosis. In endometriosis, tissue similar to the uterine lining grows outside the uterus. Retrograde menstruation may contribute to this condition by allowing menstrual blood to flow into the pelvic cavity, where it can implant and cause inflammation or pain. What are the symptoms of retrograde menstruation? Symptoms can vary, but may include pelvic pain, especially around the time of menstruation, heavy or irregular periods, changes in menstrual flow, pain during intercourse, pain or discomfort during or after sex, and infertility, difficulty conceiving, as retrograde menstruation can be associated with conditions affecting fertility. How is retrograde menstruation diagnosed? Diagnosis often involves several steps. First, a medical history and symptoms review. This includes discussing menstrual patterns, pain, and any other symptoms you might be experiencing. Next, a pelvic examination is usually performed to assess for signs of endometriosis or other abnormalities. Imaging studies, such as ultrasound or MRI, are then used to visualize the pelvic organs and look for signs of endometriosis or other issues. Finally, a laparoscopy might be recommended. This is a surgical procedure where a small camera is inserted into the pelvic cavity to directly view and possibly biopsy tissue. Can retrograde menstruation be treated or managed? Yes, treatment options vary based on symptoms and underlying conditions. Hormonal treatments, like birth control pills or hormonal IUDs, can help regulate menstrual flow and reduce symptoms. Pain management is crucial, and NSAIDs or other pain relievers can alleviate discomfort. For cases involving endometriosis, surgical intervention may be needed to remove abnormal tissue. What is the connection between retrograde menstruation and infertility? Retrograde menstruation itself does not directly cause infertility, but it is often associated with endometriosis, which can impact fertility. Endometriosis can cause scarring, adhesions, and anatomical changes that affect the reproductive organs and interfere with conception. Can lifestyle changes help with symptoms of retrograde menstruation? Absolutely. Lifestyle changes can play a significant role in managing symptoms. For instance, consuming a balanced diet rich in anti-inflammatory foods can help alleviate pain. Engaging in regular physical activity can enhance overall pelvic health and reduce discomfort. Additionally, stress management techniques such as yoga, meditation, and relaxation exercises can improve overall well-being and aid in pain management. Is there a way to prevent retrograde menstruation? While retrograde menstruation itself may not be preventable, managing risk factors and associated conditions can be beneficial. Regular gynecological checkups are crucial for early detection and management of conditions like endometriosis. Additionally, maintaining a healthy lifestyle by eating a balanced diet and staying active can also help. Can retrograde menstruation cause other health issues? Yes, it can contribute to or be a sign of other health issues, including endometriosis, where tissue similar to the uterine lining grows outside the uterus. It can also be associated with pelvic inflammatory disease, or PID, which involves infections affecting the reproductive organs. And let's not forget chronic pelvic pain, which is persistent pain in the pelvic region. How does retrograde menstruation affect menstrual flow and duration? Retrograde menstruation itself may not necessarily alter the flow or duration of menstrual bleeding. However, if linked with conditions like endometriosis, it can result in heavier, irregular, or more painful periods. Are there any natural remedies or alternative treatments for retrograde menstruation? Some individuals find relief through alternative treatments, though these should definitely be discussed with a healthcare provider. For instance, herbal supplements like turmeric or ginger may have anti-inflammatory properties. Acupuncture is another option. Some studies suggest it may help with menstrual pain and other symptoms. And of course, applying heat to the lower abdomen can help relieve menstrual cramps. Can retrograde menstruation be mistaken for other conditions? Yes, the symptoms of retrograde menstruation can overlap with other conditions such as pelvic inflammatory disease, ovarian cysts, fibroids, and even irritable bowel syndrome. A thorough evaluation by a healthcare provider is necessary to accurately diagnose and differentiate between these conditions. What should I discuss with my healthcare provider if I suspect retrograde menstruation? Well, you should discuss several important aspects. First, your menstrual history, which includes the frequency, duration, and nature of your periods. Next, talk about your symptoms, such as pain, changes in flow, and any associated issues like infertility. Don't forget to mention your medical history, including any previous diagnoses or treatments related to menstrual or pelvic health. Lastly, share your family history, especially any known conditions that might be relevant. Are there specific tests that can confirm retrograde menstruation? While there are no tests specifically designed to confirm retrograde menstruation alone, diagnostic tests such as laparoscopy can allow direct visualization of the pelvic cavity to check for signs of retrograde menstruation and endometriosis. Imaging studies, like ultrasound or MRI, can also help visualize the reproductive organs and identify abnormalities. Can retrograde menstruation resolve on its own? Retrograde menstruation may not resolve on its own, particularly if it is associated with conditions like endometriosis. Management through medical treatment or lifestyle changes is often necessary. However, some individuals may experience relief from symptoms over time. How does retrograde menstruation affect the quality of life? The impact on quality of life can vary significantly. Persistent pelvic pain can disrupt daily activities and overall well-being. Reproductive health issues, such as fertility problems, can affect emotional health and relationships. Mental health is also a significant concern. Chronic pain and menstrual issues can lead to stress, anxiety, and depression. What are the long-term effects of retrograde menstruation? What are the long-term effects of retrograde menstruation? The long-term effects depend on associated conditions. For example, if retrograde menstruation is linked to endometriosis, potential long-term effects include chronic pain, fertility issues, and possible progression of the disease. Regular monitoring and treatment can help manage these effects. Can retrograde menstruation be a sign of a more serious condition? Retrograde menstruation itself is not necessarily a sign of a serious condition, but it can be associated with conditions such as endometriosis or pelvic inflammatory disease, which may require medical attention and management. Can retrograde menstruation be caused by surgical procedures or trauma? Yes, surgical procedures or trauma to the pelvic area can indeed contribute to retrograde menstruation. For instance, surgeries like cesarean sections, pelvic surgeries, or trauma might alter the normal anatomy and flow of menstrual blood, potentially leading to retrograde menstruation. Are there any preventive measures to reduce the risk of retrograde menstruation? While specific preventive measures for retrograde menstruation are not well established, maintaining overall reproductive health can be beneficial. Regular gynecological checkups to identify and address issues early, prompt treatment of pelvic infections to reduce the risk of scarring and anatomical changes, and managing conditions like endometriosis through medical or surgical interventions can all help.